Now the question becomes, how can technology and innovation be seen in the everyday leadership setup or the everyday nursing work environment? So I set up a little bit of a process here that can be seen that makes it make a little bit more sense. So this is known as the innovative team, right? Working with your peers. How is technology and innovation seen in effective leadership? And so basically it starts with what we have now termed informatics, which is the initiation of technology. It starts with nurses and research individuals working within the field of informatics. So they take all of this new computer systems, new research, new knowledge, and they're able to gather it all up and sort of present it to the doctor, right? To a board of doctors, a board of directors. And once the research is published, it is the doctor's job to present these ideas to their fellow peers, right? So they come into the board and they're able to say, hey, look, this is the new research that's been published by these research individuals, by these nurses. Let's take a look at it. Let's implement it. Then comes the nurse. Once the doctor establishes a new evidence-based practice, nurses are responsible for effectively implementing these changes on a day-to-day basis, right? So the nurses are the ones that are on the floor 12 hours a day. They are there with the patients. They're going to be responsible for really taking these practices that have only been presented in theory and implementing them in the day-to-day schedule. And then finally, the last individual in this innovative team is going to be the patient. Because obviously we can have any research, any kind of technology and innovation come up, but if patients aren't willing to accept it, if they're not willing to have that laparoscopic surgery or try this new form of treatment or work with a nurse practitioner versus a doctor, these are the things that will kind of hinder it. So all of these individuals have to work together to make sure that technology is being presented well and that they are becoming innovative by implementing it within their specified fields.